Hello everyone. In this video we are going to discuss about general features and attachments on the sacrum. Now you know sacrum is a flattened triangular bone and that is formed by fusion of S1 to S5 vertebrae and that forms posterior part of articulated pelvis. Let me show you articulated pelvis. Here you can see on either side it is connected with hip bones at sacroiliac joint and together these three are forming bony pelvis. So the sacrum is forming posterior part of articulated pelvis. See this. Now when you see sacrum, its upper half is bulkier, see this, and lower half is tapered, narrow. Okay, it is just because as we have seen in articulated pelvis on either side the sacrum is connected to the hip bone and this portion, the upper half, helps in weight transmission, so as it is bulkier. See this. Now as you know sacrum is a triangular bone and it has a base which is situated above, an apex which is blunt which is situated below, and there are four surfaces, namely pelvic surface or anterior surface which is concave which is smooth, the dorsal surface or posterior surface which is convex which is irregular, and there are two lateral surfaces. Now first is a base which is situated upward and it is formed by upper surface of S1 vertebrae which is having a body, and on either side are costal elements and transverse elements. Now the body resembles L5 or lumbar vertebrae and it is connected with it and together they are forming lumbosacral joint. Let me connect both. So this is L5 and you can see the similarity between body of S1 and L5 and they are connected like this. In between there will be intervertebral disc and they form an acute angle over here. Now the anterior margin of the body of S1 over here you can see it is very prominent and this prominent margin is termed as sacral promontory. See this. The anterior margin and posterior margin of body of S1 will provide attachment to lowest fibers of anterior and posterior longitudinal ligaments respectively. Now posterior to body is a triangular vertebral foramen which leads to sacral canal. See this. And direction of this vertebral foramen is almost upward and slightly backward in case of anatomical position. So in anatomical position, this vertebral foramen should direct almost upward. The body of S1 should make 30-degree angle with horizontal plane like this in such a way that the pelvic surface should face forward and downward. So this is the anatomical position of sacrum. The content of sacral canal are chorda equina, filum terminale plus spinal dura and spinal arachnoid. Out of this, the dura and arachnoid will terminate at the level of S2. Now posterolaterally there are pedicles which are short, thick and they are directed backward and laterally. You can see over here. Then there are laminas which are flattened, which are oblique and they fuse in the midline to form the spine. This is in the form of spinous tubercle. Okay, so these are lamina and these lamina will provide attachment to lowest part of ligamenta flava. The articular processes are projecting upward at the junction of pedicle and lamina, you can see over here, and the articular surfaces are directed backward and medially and that will articulate with corresponding inferior articular facets of L5, see this, which are directed forward and laterally. So this is L5, this is its inferior articular facets, okay, and these two are connected like this. Now on either side of the body you can see triangular fan shaped expanded bony masses which are formed by fusion of costal element with transverse element. Now what is a costal element? The costal elements are meant to form or convert into ribs for all the vertebrae, but except thoracic vertebrae they do not convert into ribs and instead of they are forming specific structures. So here in sacrum they get fused with transverse element which is lying posteriorly and together they are forming ala of sacrum which is basically forming lateral sacral mass. See this. This is lateral mass of sacrum So these are ala. The ala are smooth medially, you can clearly see, and rough in the lateral part. The anterior portion of this rough area, which is found laterally, this portion provides attachment to iliacus, and the posterior rough part provides attachment to lumbosacral ligament. The lateral margin of ala will provide attachment to uppermost part of ventral sacroiliac ligament. The smooth medial part of ala is related to four structures which will cross the ala from in front. And to understand these four structures, let's see a diagram. So in this diagram, you can see this is the superior view of sacrum, this is anterior and this is posterior part. And what we were discussing is the medial smooth part of ala, which is related to four structures, namely from medial to lateral, sympathetic chain, lumbosacral trunk, iliolumbar artery and obturator nerve. So there is a mnemonic SLIO that you can remember: from medial to lateral, structures crossing medial smooth part of the ala, or from lateral to medial, you can remember OILS mnemonic to remember these four structures. Now next is the apex, which is situated below. It is blunt and it is formed by inferior surface of S5 vertebra, and it bears an oval facet which will articulate with corresponding facet of body of first coccygeal vertebrae. So that is regarding apex. Now next is the pelvic surface or anterior surface. As we have discussed, it is smooth, it is concave, and it is directed forward and downward in anatomical position. Now when you see it from in front, in the midline, you will see four horizontal ridges. See this. These ridges represent line of fusion of five sacral vertebrae. So here will be S1, then over here will be S2, S3, S4 and S5 bodies of sacral vertebrae. On either side of it, you can see four pair of foramina. These are termed as pelvic sacral foramina, and they communicate with sacral canal posteriorly through intervertebral foramina. See this. See the probe is coming out. See this. In between these pelvic sacral foramina, you will find bony bars, and they represent costal elements of corresponding sacral vertebrae. Lateral to that, there are lateral sacral masses which are formed by fusion with costal elements and transverse elements that we have discussed. So these are termed as lateral mass of sacrum. Now to understand structures related to pelvic surface of the sacrum, let's see this diagram. So here you can see in the midline it is related to median sacral vessels. Then comes sympathetic chain, which is related to the medial margin of pelvic sacral foramina. See this on either side of midline. The piriformis muscle takes origin from lateral sacral masses from its middle three pieces in the shape of alphabet E or inverted alphabet E. The pelvic sacral foramina will allow passage of ventral rami of S1 to S4 spinal nerves respectively, along with lateral sacral arteries. Now in the midline, the median portion, okay, which is represented by fusion of body of vertebrae, sacral vertebrae, the upper half is related to peritoneum, whereas lower half or 2.5 bodies will be related to rectum. Now next is a dorsal surface. As we have discussed, it is convex, it is rough, and it is directed upward and backward in anatomical position. Now in the midline you will see 3 to 4 spinous tubercles, and they are forming median sacral crest. See over here. They are produced by fusion of spine of S1 to S4 mainly. The fifth is missing just because the lamina of S5 will fail to fuse in the midline, leaving an inverted U-shaped gap, and that is termed as sacral hiatus. So this is the lowermost part of sacral canal. See this. And through this sacral hiatus, the fifth sacral spinal nerve and coccygeal nerve will come out along with filum terminale. Now on either side of median sacral crest, you will find fused lamina. See over here. Next to them are the articular processes which will fuse together and they form articular tubercles. Together these articular tubercles are termed as intermediate sacral crest. See over here, it is a bit faint over here, but you can clearly make out it is situated in line with articular superior articular process of S1. So together they are forming intermediate sacral crest. The lowermost part is termed as sacral cornu, which represents inferior articular process of S5. See this. Now next to that intermediate sacral crest are four pairs of dorsal sacral foramina, and like pelvic sacral foramina they connect with the sacral canal through intervertebral foramina. See over here. Okay. So similar like pelvic sacral foramina, they allow passage of dorsal rami of S1 to S4 spinal nerves respectively. Next to the dorsal sacral foramina are transverse tubercles representing transverse elements in line with the transverse element of LR, and together they are forming lateral sacral crest. Okay. So by and large in dorsal surface of the sacrum we will see median sacral crest produced by fused spine, intermediate sacral crest produced by articular processes, dorsal sacral foramina, and lateral sacral crest produced by transverse tubercles representing transverse elements. Now to understand structures related to dorsal surface of the sacrum, let's see this diagram. So here you can see there is origin of erector spinae in the alphabet U pattern, which takes origin from the spinous tubercles and from the transverse tubercles. In between this there is origin of multifidus. Okay, that also covers dorsal sacral foramina. As we have discussed, dorsal sacral foramina will allow passage of dorsal primary rami of S1 to S4. So this dorsal primary rami will have to pierce these two muscles to reach to the surface. Now next are the lateral surfaces. Now when you see it from side, in upper part you will see an inverted L-shaped smooth articular area, which is also termed as auricular surface, and which will articulate with corresponding auricular surface of the hip bone, and together they form sacroiliac joint. So here in the hip bone you can see a corresponding auricular surface which is smooth, and together these two will join and they form sacroiliac joint. See this. Now behind this auricular surface you can see a rough pitted area, and this is providing attachment to introitious sacroiliac ligament. Below over here this region provides attachment to four structures from behind forward, namely gluteus maximus, sacrotuberous ligament, sacrospinous ligament, and coccygeus muscle. So four structures are attached to the lower part. Still below, the lateral surface abruptly turns downward and medially, making an angle. Over here you can see these are termed as infrolateral angles of sacrum. See this. Now this will provide attachment to lateral sacrococcygeal ligaments. So this is regarding general features and attachments on the sacrum. Hope you have understood well. Thanks for watching.